Hello everyone. As part of the material education from the Committee of Education and Training from the World Allergy Organization during the Allergy Week, I would like to talk about the psychological impact of the COVID-19 pandemic in patients with allergic diseases. As a background, in historical background, on March 2020, the WHO declared COVID-19 as a pandemic disease. SARS-CoV-2 is highly contagious, capable of causing severe pneumonia, acute respiratory distress syndrome, and death, particularly in those populations that are very vulnerable, such as those with previous respiratory diseases. In patients with allergic disease, it is recommended to monitor their allergy and asthma symptoms, as they can lead to a misdiagnosis of COVID-19 and there may be overlapping symptoms. The interactions between the allergy-related inflammatory and psychiatric disorders, including depression, anxiety, and PTSD, post-traumatic stress disorder, have been plenty documented. Speaking more specifically, asthma, rhinitis, or atopic dermatitis, and the combination of all of them as a comorbidity have been associated with a higher risk of psychiatric disorders. This higher incidence of this allergic disease has been seen in patients with post-traumatic stress disorder, PTSD. Immune activation has been suggested to be a contributor to the clinical status. As an objective, we try to identify the psychological impacts of the COVID-19 in patients with allergic disease and determine if these subjects have a greater risk of presenting PTSD, post-traumatic stress disorders, and or depression. We performed during 1 month, between the 1 to 30 of April, more than 4,000 questionnaires as a cross-sectional survey-based study in order to assess the degree of the symptoms of depression, anxiety, and the risk of the PTSD using the Patient Health Questionnaire, PHQ-9, and the impact of this kind of events, scale revised EISR, respectively, in the allergic patients population. This study was approved by the Clinical Research Ethics Committee of the University Hospital and Medical School of the Universidad Autónoma de Nuevo León in Mexico before the initiation of this study. I would like to share some of the results that are very interesting. Listen, a total of 4,106 surveys were evaluated from 24 different countries around the world. 40.3% of the patients with allergic diseases and 59.7% of them were non-allergic subjects. 76.6% had respiratory allergic disease, including asthma and allergic rhinitis, both as a combination. Los subjects with allergic disease presented the highest scores regarding the symptoms of the PTSD on the IESR scale, as well as a higher depression risk score in the PHQ-9 questionnaire. Patients with asthma and allergic rhinitis presented higher scores to develop the PTSD and depression in comparison with the patients with allergic disease without asthma and allergic rhinitis. What we can say about these very interesting in very brand new results regarding the psychological consequence? Well, we found out that this psychological consequence as depression, anxiety, and PTSD are present during the pandemic of COVID-19, causing by a high impact in the subjects with allergic disease. If we acknowledge this impact and how this is affecting, we are able to have implement interventions, follow up on contributions to the entire well-being of our patients. So that is very important to have this psychological impact of any chronic disease, mostly in this very unusual circumstance that we are facing in all over the world regarding the pandemic COVID-19. Thank you very much.